Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. In this video, I will go over 7 points. First, I will go over a quick overview of normal healing cycle that will help us to understand the mechanism of Graston or astym and assisted soft tissue release work in the body. Second, I will give you a quick history of Graston Technique, Gua Sha, and astym. Third, I will compare between different designs, the designs of each tool. Fourth, I will give you feedback of how it feels on the body, the different instrument. Fifth, I will go over the methodology and I will compare between different methodology of treatment for the instrument-assisted soft tissue mobilization. Six, I will go over the literature review, the study that actually done on Graston and astym, and the conclusion of the researchers on the efficacy of each modality. And lastly, I will go over the best solution for pain relief. Give you a quick overview of normal healing cycle. I usually lecture the healing cycle in ASTR class. The lectures are around like 4 to 5 hours in depth with and more detail. But I will just give you a quick overview of the normal healing cycle so it will give you a better understanding how instrument-assisted soft tissue really mobilization actually work. So the first stage for healing is inflammation. So I'm just gonna use external paper cut for visualization, but the same process happened internally from accident, trauma, poor posture, poor body mechanic. With any injury, the body has to go through those 3 stages in order to heal. If the body does not go through those 3 stages, it's actually did not heal. It's either stuck in one or going back and forth between the first 2 stages, which inflammation and proliferation. So, for example, external paper cut. So the first stage is inflammation. During that stage, you will have increased temperature, redness, pain, and decreased function. Second stage is the proliferation stage. That's when our body starts to build a scar tissue. As you see in the image, the wound starts to close and you start to have a scar tissue that covers the area. During the proliferation stage, there's a cascade of events, which include scar tissue buildup or fibrosis buildup, fascial restrictions, muscle spasm, and trigger points. I have other video that I went in more depth for each of those subcategories of the proliferation stage. I'm not going to go over this in this video because I have specific videos for each category. Feel free to check it out underneath this video. So during the proliferation stage, the body starts to build a scar tissue. If the body actually does not build a scar tissue, it's open wound susceptible for infection. So scar tissue actually very essential for our survival. The third stage of healing is called maturation. During that stage, our body actually gets rid of the scar tissue and everything resolved. It could take days, weeks, months, or years to reach the maturation stage. When someone experiencing pain, they usually not in maturation stage, because maturation stage, it means the wound healed or the injury healed. So usually the patient I see that has injury or strain or any kind of injury, they usually either going back and forth between inflammation and proliferation or is stuck in the proliferation stage that they just need release for those subcategories, which fascial restriction, muscle spasm, trigger point, and scar tissue, to transition them to the maturation stage. So by understanding the normal sequence of the healing cycle, that will help us to know the methodology of each tool, like Graston Technique or Gua Sha, is it actually really doing what they say it's doing, or it's actually doing something else? History of Graston, Gua Sha, and astym. So the instrument assistive soft tissue mobilization, it's actually originated in Asia over 2,000 years ago, and it's called Gua Sha. Graston Technique is actually developed by David Graston in 1994 to break up soft tissue. I'm actually using quotes from different blogs for the definition of Graston. So Graston was developed by David Graston in 1994 to break up soft tissue fibrosis and decrease chronic inflammation in the specific areas of the body. This technique uses stainless steel tools to create deep rhythmic pressure in specific areas. The goal of Graston Technique is to break the adhesions formed and around the muscle to bring inflammation. This is a problem here. They actually want to cause inflammation. And when you go back to the healing cycle, if you cause inflammation, instead of you going downward for the body to heal, so actually they actually stimulate more inflammation, which actually gonna cause more scar tissue or more fascial restrictions. It's gonna create actually a vicious cycle that go in between inflammation and scar tissue, and I will go over that in detail later. So they believe the inflammation, this is a quote, the inflammation brought to the area will create healing process that will not only heal the new micro traumas caused by the techniques. So actually they believe they want to cause new micro trauma to the area so it will heal. That's a misperception, because it's a healing cycle. The healing cycle has not been disappeared that you want to cause healing. It's already there. But the problem is the body is stuck in certain stage of healing. It's not stimulating healing, that's misperception. It's actually stimulating inflammation, which when you think about and looking at the diagram of normal healing cycle, if patient comes to me for proliferation, is stuck in the proliferation stage, and the therapist actually perform like metal tool or any tool that actually stimulate more inflammation, we transition the patient from the proliferation stage up to inflammation again, which gonna turn to the next image that you see in the screen, that the body going between inflammation and proliferation stage. Going back to the same quote, so those micro traumas actually caused by this technique will heal the original damaged tissue that caused the adhesions to form initially. I'm like, how you guarantee that? So I will give you a very good example. Someone come with a cut. Does it make sense to say to that person, okay, I will cut you more so your body heals faster? That's exactly what they do. They actually, you have a trauma, you have an injury, so the belief is actually we're gonna cause more trauma to that area that's actually gonna help you to heal faster. Does not make any sense. So if a patient comes to me, I have a cut now, I'm like, okay, this cut is not healing. Let me cut you bigger cut so the original cut will heal and the new cut will heal. How you guarantee that? It's another good example that you are going to mechanic and there is a part that broken, and the mechanic tell you, okay, this part is broken, but to fix it, I'm gonna break it more, so we'll fix it. Bad methodology. So let's go to the definition that actually I quoted from Graston Technique website, and you can see it in the screen. So Graston Technique, GT, is a unique, GT abbreviation for Graston Technique, is a unique evidence-based form of instrument-assisted soft tissue mobilization that enables clinicians to effectively and efficiently address soft tissue lesions and fascia restrictions. By the way, fascia restriction, there is no proof that they can release a fascia restriction, and I will go over this later, resulting in improved patient outcomes. So the use of Graston Technique instrument, when combined with appropriate therapeutic exercise, lead to the restoration of pain-free movement and function. And the most important part of this is the combine, and that's an indication that the Graston technique or instrument assistive techniques are not enough by itself. And even the developer or the teachers for those techniques, they are aware of that, and they are aware it's by itself. And I'm gonna go over the studies actually that's showing instrument assistive soft tissue release is not very effective, and they want to include other things with it to actually make it effective. Now I'm going to go over a design comparison between different approaches for soft tissue release, or instrument assistive soft tissue release. The first thing is Graston. So Graston is actually a stainless steel tools. It's very expensive, so I get a copycat instrument that is very similar to it. So to show it to you in the camera here. So it's a metal tool. There's different shapes for it. It's metal, some part of it actually very sharp, others are a little bit thick, small size. You can see it here actually with the blue background here. And some big size. As you see, it's looked like a weapon. Yeah, it's actually one of my patients was telling me he had a treatment, and then when I asked him like what kind of treatment, he said, yeah, it's looked like a butter knife. So it's basically like, you know, knife look different than this a little bit, but it's a basic stainless steel rod, you know, just shaped differently a little bit. So those are the metal instrument. Graston is a stainless steel metal instrument. There's a lot of copycat out there that look similar. The difference slightly between the curvature is not really a huge difference in the application or the feel of it. I tried several of them and it's all also feel the same. It's all metal. So the other design, which for Gua Sha, is actually it could be plastic, stainless steel, or it could be like a stone, sometimes buffalo horn, and this is actually a Gua Sha. As you see, it has edges. It's very thin actually. They have a different shape, so you can work on a different body part. It's very like pointy a little bit. So that's just the design and the material. The second thing I want to go over is ergonomics. So as you see, it's like a piece of rod. So ergonomically, it's not very ergonomically designed for healthcare providers, because it's actually long-term with the frequent patient throughout the day, 20-30 patients a day doing this, that will actually could develop carpal tunnel or trigger fingers. And I had interview with a couple of therapists that actually use metal instrument, and they indicated that they start to have symptoms of carpal tunnel, and other therapists actually develop trigger finger from using this instrument and just on the frequent, like for several months. So ergonomically it's not very well designed, like as you see, it just not comfortable. And even with the big tools, it's very heavy actually, and it's the same thing. It's a very not ergonomically designed. And when we look at the Gua Sha, it's the same thing. You know, even if it's pinpoint or you just have to really grip very hard to with your thumb and index or with your palm like this to actually work on patient, which actually not very the best design for the hands. How to avoid that? So I designed the ASTR tools that it will have handle to actually easily work on patient without using the fingers. Use the big muscles, and that's part of the patent of ASTR tools is actually the ergonomic design of the tools. So the other issue is the edges and the sizes. So because Graston Technique and Gua Sha or instrument-assisted soft tissue mobilization, they believe to cause micro trauma or petechiae, and I'll go over that in a little bit, that they designed the tool to be edgy. And the reason for that, like sharp edges, is actually to cause trauma. And when you cause trauma, that's actually going to cause more scar tissue. It's just a vicious cycle that the body can go between inflammation and proliferation again. The methodology of Graston or instrument-assisted soft tissue release is to cause micro trauma, bruises, or petechiae. Let me get the definition on the screen. So petechiae, by definition, is actually a small red or purple spot caused by bleeding into the skin. You see in the image, actually, after Gua Sha treatment, I have images for after Gua Sha treatment, someone put it in their blog, and Graston. You can see the redness, the purpleness, the bruises. Here's a big problem here, okay? So if a patient comes to me with the cut and they want me to treat them, do I tell them or I do this? Okay, you have a cut, I will cut you more so this cut pain, the old cut pain, will heal faster. I'm not sure where is the common sense with this methodology. So to heal or to actually help patient that has injured part of their body, you should not cause a new injury. The common question for a patient and healthcare provider that's interested to learn or use astym or Graston or Gua Sha, whatever you call it, instrument-assisted soft tissue mobilization, how it feel, how the patient feel. Let's check what healthcare provider that practicing Graston, what they say. So a chiropractor says, her name is Lindsay Matthews, and her website, and even with the laser, I still continue to warn people that they may experience redness or bruising and the next day or two, and they may also be sore. So let's hold on here, okay? So redness and bruising, what that mean? It's inflammation. That's exactly what they teach in a lot of these courses, that we want to stimulate inflammation. So let's look back at the healing cycle now. So normal healing cycle, you go from inflammation to proliferation, and hopefully you get to maturation. That's mean your body healed. But when patient comes to healthcare provider, and the healthcare provider say, okay, so you have a scar tissue or you have injury, and you might be like stuck in the proliferation stage. So how we can get you down is by going upward, by causing inflammation, increased temperature, loss of function, redness, swelling, and pain. So this is exactly what happened here, which actually the coronary condition, when we cause inflammation, that inflammation gonna cause more scar tissue, fascial restriction, muscle spasm. It's a vicious cycle. And the problem with this belief of causing inflammation, that there is no guarantee the new trauma that caused by the therapist is actually gonna heal, and it will help to heal the old trauma. There's really like big gambling here that I have hard time to understand how they justify causing more inflammation to causing more scar tissue. So let's look at what patient actually saying about Graston. So this is a blogger, his name Kim. This is his quote about Graston technique. Be warned, the Graston technique is not for the faint of heart. It hurts like heck while it's going, uh, while it's getting done. Think of metal tools digging repeatedly into an area that is already injured. Let's pause here. Okay. So you're injured now. You go into a healthcare provider that has a metal tool, and they actually, it's a very good example. Like you have a cut and you go into a healthcare provider that's saying you feel pain from this cut, from this injury. Let's actually cut you more. So so the new cut will help the old cut to heal faster. It does not make sense. So he's also saying, plus it will leave you pretty tender and bruised for a few days afterwards. Let's look at the picture that he posted about his calf when he got Graston treatment. So after a few hours, after one of the session, he had several sessions. You can see the bruise here actually. A few hours afterward, it looked like someone beating him up. So let's look at what happened. Few days. He's still in inflammation stage. So does healthcare provider guarantee that all this bruise is gonna heal faster than the old injury and actually will help the old injury? Very bad, poor methodology. I hope healthcare provider that's actually teaching that to rethink and use some common sense and look at the normal healing cycle. Our duty as a healthcare provider is do no harm. Your treatment should help patient, not actually making them worse. So let's look back at the healing cycle. This is exactly the inflammation here, causing inflammation, which means that they're gonna go to the proliferation if their body going down to heal, but you causing that going back and forth. It's a vicious cycle. Please rethink doing that to your patient. So let's look at other. Now this is a picture I had from YouTube. All these quotes and picture, I have the link here in the screen, so you know what I'm bring it from. So this is a Graston technique. As you see, it's inflammation. It's actually worse than inflammation. He just bruised him very bad. Unfortunately, it looked like he was tortured. Okay, let's look at Gua Sha. Gua Sha is the same thing. They believe you wanna cause petechiae. Petechiae, by definition, as we said, is redness. It's bruising. It's actually causing bleeding. So look, the first day, immediately after treatment, he was just like really bad inflammation, bruising. 24 hours, he's still bruising. 72 hours. Can you guarantee that bruising, it's actually going to cause a new scar tissue? Can you guarantee the new scar tissue actually going to heal, go to maturation faster than the old scar tissue, and actually wipe the old scar tissue as they claim? I'm not sure about that. So let's look at the studies on instrument-assisted soft tissue mobilization. So this study is a systematic review. They looked at the efficacy of instrument-assisted soft tissue mobilization, STEM. So I'm bringing systematic review because that's a very good, reliable source of research that we can base our clinical decision on, not like a case study or just poor quality study. So they looked at different databases, and they were able to find 7 randomized controlled trials on instrument assistive soft tissue mobilization. Some of those trials would on Graston Technique and other ASTM's copycat instrument or plastic instrument. So their conclusion is the current evidence of randomized controlled trials does not support the efficacy of IASTM for treating certain musculoskeletal pathologies. There is a weak evidence supporting the efficacy of STEM for increasing lower extremity joint range of motion for a short period of time. So even though there's a lot of hype about, oh, it's a speed the healing process, it's stimulate healing, evidence showing there is no function improvement, there is no efficacy for those kind of treatment. Unfortunately, a lot of those techniques, they say we are evidence-based, as I mentioned to you in the beginning for some of their definition. They base it on case studies and poor quality studies that's not like providing a good evidence of the efficacy. But when we look at the pool of studies, and that's more reliable place for good conclusion. So what is the solution? So let's look at a study done on different modalities, and that will help us to answer this question. So this study evaluating the effectiveness of treatment options for pain. This is a literature review. So the researcher in this study, they looked at over 16,000 articles. So when they were looking first at systematic reviews, because that's the most the reliable source of information that we can get for clinical decisions. And systematic reviews, they did actually the homework of a study, hundred and thousand of study to come to the conclusion of the systematic review. So they did the legwork. But when the researcher could not find the systematic reviews for certain modality, they looked at literature reviews. So they had included 2 literature reviews. When they could not find literature review or systematic review, they go and do down the list to randomized controlled trial and then non-randomized controlled trial. So the strengths of the studies is systematic review, literature review, randomized controlled trial, non-randomized controlled trial. So let's look at their finding, or they actually in that study they have 2 separate categories they looked at. One is a single model, and they put all single model or single modality on that category, and the other category was a biopsychosocial model category. So they get the systematic reviews on these elements. The link for this study is down the video. So the systematic review show for those modalities shows it's the single model provides short-term pain reduction, and as you see here, instrument assistive soft tissue mobilization is short-term. There's no efficacy for that, but majority of those treatments provide short-term joint mobilization, massage, manual therapy, even manual therapy with exercises was the same thing. So you can review that study in detail. So when they looked at the biopsychosocial model, they found in the literature it's used to be called on multidisciplinary approach. It's actually cognitive behavior rehabilitation, advanced soft tissue release, ASTR. So all of these actually interchangeable terms for the biopsychosocial model. So when they looked at those studies, there was 9 studies, 7 of them actually were systematic reviews, and this is the conclusion of their study. Treatment methods following the biopsychosocial model seem to yield long-term pain reduction, increased range of motion, and improvement in functional activities. On the other hand, the single modality treatment methods seem to yield either short-term pain reduction or no pain reduction. So the solution is the biopsychosocial model. So I just want to clarify something, that a lot of people have the misperception that ASTR is instrument assistive soft tissue mobilization. This is not even 10% of ASTR treatment, because ASTR is a biopsychosocial model. So I will clarify that in the definition of ASTR. So ASTR is a biopsychosocial treatment model that utilizes ASTR instrument. Why I invented ASTR instrument? Because I find a lot of problems with the current instrument assistive devices that use for soft tissue, from design, from methodology. So what the solution is, just invent something that actually work fast and actually does not cause inflammation. If the therapist actually follow the ASTR protocols while they're using ASTR treatments, they should not cause inflammation. And when you see in a lot of my videos that I usually say to patient, make sure you don't feel pain, because pain is sign of inflammation. And if I cause pain and causing trauma to the area that's actually injured, that will do the same as Graston and Gua Sha. And I don't want to do that, because it's a bad methodology. It's poor methodology. So the treatment should not aggravate the symptoms, and that's why I tell patient and the therapists actually that use ASTR tools, they usually do that, because we don't want to cause inflammation. So let's go back to the definition. So ASTR utilize unique ASTR instruments, maneuvers, theories, and methodologies. So ASTR treatment includes working on multi-aspect, including scar tissue. So I have a special instrument for scar tissue, and other special instrument for fascia restriction, trigger points, muscle spasm release. We work also on ergonomics, gait, exercise, nutrition, inflammation, stress management, and behavior modification. This is the entire biopsychosocial model. That's how we treat the source of the problem. And to really understand that very well, I will recommend you check the video that for what is ASTR. I have the link down this video that I go in details on why we have to treat the entire system instead of body part. So feel free to check that video. So the biopsychosocial model, the bio part is the musculoskeletal, neuromuscular, fascia, fibrosis, trigger point. We work on the posture, body mechanics, gait, nutrition, lifestyle for the psychosocial part of it. So that's the solution, and there's a really strong hard evidence support the biopsychosocial model. And there's over 40 study. I actually have it in ASTR Institute website under research that shows the efficacy of the model. The model has to be like 3 to 4 elements to be considered biopsychosocial model. ASTR actually cover 11 elements, so it increases the chance of the success because we treat all aspects of the problem. So the take-home message, please, if you are a healthcare provider, do not cause inflammation. Do not use tools that actually cause micro-trauma because of the poor design and poor choice of material. Metal is not the best material to really release soft tissue. As that patient said, It's like a knife. It's actually just keep traumatizing injured area. We should not do that. We should help patient. Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.